would like to introduce our special guest for today. Sonia, I've known for maybe 5 years now, and I'm excited because she's not very far from me. So I've been able to meet her in person a few times, but last month we went all the way to Bangalore so we could have a reunion, right? That was the only purpose, so we could meet together. But she has come from many different seasons in her work. Not only is she a lactation professional, but also a doula, also a prenatal yoga teacher, also a childbirth educator. And so she offers comprehensive services to families. So she's bringing really unique insight to us when we think about how to best support families. And most of her hours these days is in a hospital setting. I would say that. Is that true about you before I say that? Okay. So most of her hours when she's supporting families is in the hospital. So let's hear a little about her experiences with that. So Sonia, can you just tell us a little bit about where you work? What is the format? How long have you been doing this? Just a little background of the work you're doing every week.
Yeah. Thank you, Dana. So please forgive me for my throat, my voice, because I'm having a very bad sore throat. So yeah, I'm working with a hospital in Faridabad, Haryana, in Asian Hospital, where I am working as a maternal and child wellness consultant. My role is to take antenatal classes, but not all the mothers take antenatal classes. It's by choice who they come. But I do take IPD rounds, like the moms who have their babies there. I meet them in the hospital at that time and at the discharge. And I have now recently, it's been more than 6 months now, that I have added my follow-up with the pediatrician appointment. Like when they are visiting after discharge, they are visiting the pediatrician. Now they meet me also. So that's a very big celebration that I would like to celebrate someday with you all. So this is how I'm supporting families.
Yeah, that's amazing. So that's been a journey. Can you just talk about just some of the steps from you desiring to meet families for follow-up and then actually achieving this? What were some of the steps you had to take as you interacted with the pediatric team, the OB-GYN team, and the other teams in your hospital setup?
Right. So, when I started taking rounds, so it was a very new thing for the entire, OBGYN team and the pediatrician, because lactation profession is quite a new profession, and they don't just trust you because they are quite concerned about the baby's glycemic levels, that, the baby should be well fed. They don't think twice about feeding the formula. It's not that they are favoring formula, but they are really concerned that is someone actually going to be there to teach the family about feeding, latching, so the baby and mother both are well taken care of. So, and when I started in the hospital, it was a very tough journey. Yes, you helped me a lot of times. But having that confidence, I always kept my intention to support families for what they needed with the guidance. And after my every follow-up rounds, if ever I see a red flag, where the mom is not, ready to feed, or there is something going on with the baby, so I used to go to the respective pediatrician and tell them that this is what I've observed and what is your suggestion, or for me. So that's how I built confidence with the pediatric team, that I'm not here to interrupt in their work. Rather, I do understand, and I have that skills to evaluate things, that everything is going well, like the baby's weight and urine output and the latch and everything. And slowly I requested them, and it would be great that if I can meet them on the follow-up when they're coming to meet the pediatrician, so that we can take a call from there, that how's the breastfeeding there. So that's the second step. Like, one is the hospital, while they are staying in the hospital, the discharge, and then the 5th day follow up with the pediatrician. And if something is not working till then they have a follow up visit with the OBGYN on the 8th day after the birth. So I do call them, and by the time I feel that in all this 1 week, all the hurdles are mostly covered. If they are facing any latching issues, pain issues, optimal milk transfer is not happening, the baby's weight or whatever, this gets resolved. So this is how it is actually now coming into place.
That is a great model. And as Sonia has been saying, you can hear this in her story. It's taken a lot of time. It's taken a lot of relationship building. It's taken a lot of opportunities to earn the trust of other professionals for the work that she is doing, that lactation professionals are doing. And so that's really encouraging to hear a success story, right? Because so many weeks we do face challenges and we feel like, when is this going to get better? And so it's so great to meet Sonia today. And here now, she can also be a part of the follow-up package, the plan, and that time period that we know that first week is so crucial. So Sonia, I'm going to take you back a little bit to a family who now just had a recent delivery and now they're getting ready to go home. So we can say that this was a cesarean delivery. This is their first baby. And so can you just talk through some of the crucial skills that this family, this parent, this mother needs to be confident in before they go home?
Yeah, right. So before, actually, it's a very, very actually a crucial point when they're going home. I would just like to start this with that, first of all, we have to be confident enough to suggest them or make a discharge summary for them, because how are they feeling right now? Because it all matters on what was the gestational age of the baby when the baby was born. What sorry Oopsie. Ah, so what was the gestational age of the baby when the baby was born? How is the mother? How's the mother's pain? Because if it is a C-section, the mama is always in a lot of pain, and addressing and being compassionate about her pain is very, very important. And because then she understands that, we suddenly cannot enter the room and tell her, breastfeeding is very good, you must breastfeed your baby, that is the only food that you should give to your baby. And rather than, because as I said, most of the parents have not taken any antenatal class, so asking them, how are they feeling, what is their understanding about the breastfeeding. And when they say, oh yeah, I want to and I tried but it didn't happen, so as I told you, recently I've like making my space in the hospital. So I've been assigned a nurse in the morning hours who go in the latching hours of the morning, and rest of the staff is also very, very confident who assist them. But someone is there apart from me to teach them how to position and hold the baby. So they said, yes, the nurse helped us, feeding the baby. And then I pick it from there, that how are you feeling, or if it is a previous latching that has happened. And then what did they observe? Was it painful? And how do they, and then I asked them, do they know that what are the signs that the baby is having enough milk? And then they say the baby was sleeping. And then I asked them, what are the signs that we are having enough milk, or enough food, sorry. So it's usually the conversation with the family, because if the mother is active and wants to participate in the conversation, then it's fine. Otherwise, I ask the mother-in-law or the mother of the mother or the father that, what do you think, how do we know that we are getting enough food? So then they say, wait, we are happy. And then I point out the urine and the poop and how much the baby is taking, and some information there. So this doesn't happen in one conversation, of course. This is about 2-3 conversations that we have had in the stay at the hospital. And at the day of discharge, we are talking about, I've just questioned them again, that what do you feel now, how much, what do you think that how often do you think the baby is going to feed? What was your experience? They say, sometimes the baby woke up in 1 hour. The baby was sleeping all through 3.5 hours. And then they reassure that, yes, this is fine. But, my baby wasn't sleeping at night. I said, and then I bring the awareness about the change of environment for the baby from the womb to the outside world. And then they understand that as well on day 2. And then at the time of discharge, they are like almost, they have this skills of evaluating urine output, poop output, and baby is able to latch without, where mama is not feeling pain in the nipples at all. And that's it.
So if you think about some of these families that okay, let's go to like the ideal. So this is a family now who's come to ANC classes with you. This is a family who delivered in your hospital now and has met you several times. And now this is a family who has this plan. After 5 days, they come for a check, and they also can meet with you. Can you just talk about what is their success in their lactation journey based on those ideals?
Yeah. So in comparison to that, there are two things. Okay. I have seen that as well. Firstly, the mothers are more confident about how to position the baby, how to hold the baby, and how to latch the baby on the breast. And they are well aware of the signs that the baby is having enough milk, and the baby sleep cycle, and general awareness of the how do babies respond in the outside world. But having said that, I have seen sometimes mom do take it very idealistic approach to initial days of breastfeeding, where I would really like to request every one of us who are taking antenatal sessions that please, yes, give them a uh, plan, that you do tell them how it works, but what is the plan B? What if they are feeling a lot of pain? How can they go slow? And it's okay if they're feeling pain, because many a times I've come across who have not taken classes. I'm not saying I'm a best coach, but I've seen moms who have this perspective, oh my God, I should be feeding my baby right from first feed. I should be, up and above on the bed. I should not, and my baby should feed well, and it should be okay. And where things have gone wrong very much. So I think a lot of things happens in the sessions, antenatal sessions. But yes, they do feel. I do feel a very much difference in the confidence level of, because information makes us feel safe. They have this knowledge of holding and positioning their baby, the signs of good latch, there is no pain, and they are pointing out, ma'am, I'm feeling pain. So I'm still feeling pain in the nipple, because I am always asking them, do you feel pain in the nipple while the baby is sucking? And surprisingly, Dana, the pain thing, many a times the mother says, no, it's like, the sucking pain, even the pinch pain, na, they'll just think that, okay, it's painful, because everybody in the family says it hurts when the baby suckles. Then I've started asking them the question, moving their tongue to the tip backside of the teeth, to the upper palate, the hard palate, and the explaining them, how it should feel. Do they feel still it's rubbing, or do they just feel it's like this? Then they are able to evaluate, oh, no, there is pain. And then I ask them, okay, would you like to support the breast from the bottom? And then they try it, and then they attempt the deep latch, and then they say, oh, now I know this is how I should feel.
So if you think about the families where now this is going well, and we think about now they know that they have this appointment on the 5th day, do you find them messaging you, reaching out to you before that 5th day, or are they now waiting and putting all of their challenges into that one consultation?
So I do offer, there is my number, hospital number is there definitely in the discharge summary as well, in case they have challenges. So some of them do message me that if they are facing any challenge. And also what I do is, actually I also share a latching video and a different positions video with them, so that they can see it also and try it at home. And in case they are not able to, they are still facing challenges, they can message me, or they can come before the follow-up plan if they are having any challenge at home.
Okay. So then they'll come to the OPD for follow-up on
Yes.
their own. Okay. That is great to hear. So my last question is just about a recent case. Can you think of a recent example where you had this relationship with a family through these different stages, and then the breastfeeding journey, the lactation journey went really well? Can you just share a story about that?
Yeah, I do come across many follow-ups because in my hospital where I work, there is about 70 to 100 births in a month. So there was this mom whom I just met 2 days ago again. So this was a mother. This is a mom who is 38 plus 4, who had her baby at 38 plus 4 days, 38 weeks, 4 days, through C-section because she had IHCP, which is a liver condition that affects bile flow during pregnancy. So the doctor said that it is too high and they didn't want to wait. So they, got the baby out. Now, this mom was definitely moms gain weight during pregnancy, but she was always on the higher side of the BMI, and her abdomen circumference was too big that even after the baby, when the stomach sags, the abdominal muscles sag, it was too much. So she had a lot of pain in the stitches. So she was feeding her baby for 2 days in lying down position, and she was ready to supplement her baby as and when required. She was feeding directly most of the times, although she had good colostrum flow. I mean, the urine poop output was nice, so not as such like recommended supplementation was there. So on the day of discharge, I just asked her. I always prefer to ask the mother if she would like to change another position if she's comfortable. So if it is a C-section mom or if it is a vaginal delivery birth mom, there are stitches that comes at the perineum area, right? So I do offer them the comfortable positions in which they can sit comfortably. So she said, yes, I would like to, but I can't just come in front so much. It should be a very semi-reclined set. So she attempted football hold, which she liked so much, and then she tried it, and then she went back. Now, she was supposed to come for the dressing change every day, but she came to meet me on fifth day follow-up saying that, I feel a lot of pain in this position as well. And the baby was just at the same weight as like the discharge weight. The color of the poop was greenish yellow. The urine output was fine. So this is all the points that I do check in the follow-ups. So I then showed her the position, how she can feed the baby in lying down position. And this is what I have also told her at the time of discharge, that if she can practice to turn sides while at home, because this will help her in trying out different, lying down position as well. So she came to me on fifth day and we tried this lying down position, but she wasn't very comfortable. So we took the other method of hand expressing. She started hand expressing. Now this may sound like a very ideal scenario with this kind of a thing, because most of the time moms are not willing to hand express. For 2 days she did hand express, but on third day she started pumping and she was feeding like the baby with the expressed milk and with the direct feeding. Now, on eighth day, when she had to meet her doctor, like 2 days ago, she again came to me and she said, now I feel I'm ready for a lying down position. So then she came and then she tried lying down feeding position. And when she started feeding her baby, and then I met her yesterday and she said, ma'am, this is the easiest position because being so large in size, I really find it difficult to keep the baby here because my stitches hurts and the belly is sagging, so my stitches hurts at the bottom. There is high risk of moisture in there. So she was quite happy, and the baby is also gaining weight. The baby is almost touched her birth weight in 8 days, so which is like a good sign without any supplementation. So yeah, there are moms like this that I come across as well.
It's so good to hear that, right? Because we have lots of days where it doesn't go so well, and they think, oh, if I just meet a lactation professional, lactation consultant, then the latch will be fixed and everything will be fine. But because of your model of following families so closely in those early days, you can really prevent some of the challenges that come then if we don't meet them until the first month, right? So us working more in private practice in Dehradun, often families come on week 3, on, after the first month, after the second month. And so then we have to prepare those families for these expectations. It's going to take time. But if we are in those first days, just even a position change, even, educating them about effective milk transfer and output like you're doing, we can have a huge impact. Okay, Sonia, my last question.
I just want to quickly just say one more case if I can share.
Go ahead.
So this was a second time mom, and this is a second time mom who had her baby vaginal birth because of high blood pressure. She was induced and the baby came out. It was successful. Now the breastfeeding established within an hour. So this baby was born at 35 weeks, weight 2.7 kgs. So doctors are quite happy that the baby is going to feed. And so she started feeding. The baby was feeding, but vaginal birth mothers are discharged the next day. Within 24 hours, they go back home. So everything was fine. She came to me on 5th day. The baby's weight was 2.5 on day 5, but her nipples were damaged. So, we just counsel. I just asked her that, again, whatever strategies we use, how I assess the latch, how is she feeding, latching, does she feel pain? And then she said, yes, I do feel pain. And so as I told her, this is a second baby, she was surprised to meet me in the room that, oh, there is a profession called lactation professional. Why do people need help with lactation professional? And so she went, and then she came back on 5th day addressing these issues. And then she said the baby's poop color is green, the urine output is 4 on day 3 to 4, and the weight was 2.5 without clothes. So I said, okay, the nipples are damaged. I supported her, guided her, deep latch, how it should feel, what are the signs of optimal milk transfer, what are the why she should not feel pain, with the images and everything, with everything. Now, when I asked her to come and meet me on day 8, the baby's weight was 2.5 again, but the poop color was yellow. So I then went to NICU for do the test weight. So she fed the baby for 20 minutes. There was no weight gain. And then I supported her, asked her, okay, do you feel any change? And then we did the test weight. There was an increase of 30 grams. So then she understood, oh, I was ignoring the pain that I felt during the feeding session. So now the pediatricians have now also started asking that, okay, now our lactation professional will come and she'll guide you. So I can see the success in breastfeeding rates, definitely. But
That's so encouraging too, right? And so you're watching these families closely and you have that relationship. And so that weight gain in day 8 could have been for weight gain in day 80, right? Instead, it's in those early days, those early weeks. Okay, my last question for you, Sonia, is Sonia has a dream. So if you think about in 1 year or in 5 years, and if you're still working at this hospital, what is a dream of yours that you would like to see accomplished next?
Okay, my dream would be to have a team in the hospital who can assist the mom even with the C-section in the OT, in the operating theater, or in the post-recovery room, because there is something with where I'm lagging. and I would like to see the moms, more support in the work that I do, in the same work, and I can train more nurses in the city, in the more hospitals in the city, so that there is skilled professional care maximum available in the area around me. I just don't want to be it in this hospital.
That's amazing. So it's not only your hospital, but you want to see it in your city, in your region. And so we're going to keep going together. So thank you for being with us today, Sonia. That was so helpful. And to hear from someone, often we get this question, okay, now I'm certified. Now what do I do? How do I get a job? How do I support families in the hospital? I'm non-medical. How do I learn this field? And so you have people listening today, people like Sonia who've gone before you and have walked this path. And now Sonia has lots of clinical experience and she wants to see people trained with these skills. And so we want to connect you with people like Sonia, right? And we know that mentorship really has an impact, not only on the lactation community, but that we can see families receive better skilled lactation care throughout India. So thank you, Sonia, for your time today.